Welcome clients and guests to my channel. My videos are designed to educate and empower you to make informed decisions about your mental health. My name is Jason Sarro and I'm a licensed professional counselor. Please like the video and pass it along to someone you believe it may help. I recently released a video on how the brain is affected by trauma, and I recommend you take a look at it because it explains the impact of trauma on our brain chemistry. I also recommend you take a look at my video on PTSD and complex PTSD, where I cover what those mental health conditions are and make some distinctions between them. Here are 6 forms of treatment for healing trauma, and how it is my belief that we must use more than one approach to target its complexities and intricacies. Treatment for trauma includes eclectic treatment orientations like number 1, dialectical behavioral therapy, DBT, which helps aid mindfulness. This is the connection of body and mind awareness, and promotes self-regulation skills on dealing with the stress, self-harm urges, and suicidal thoughts. Number 2, antidepressant medication to lessen the impact of the symptoms experienced. Number 3, exposure therapy, which gradually and systematically confronts the trauma while attempting to self-soothe and reconstruct the events. That's more of a combo treatment of desensitization therapy and DBT. Number 4, cognitive behavioral therapy to help replace negative associations with more positive, rational, and productive thoughts. And just as a side note, I have found CBT to be effective mostly in helping someone to stop blaming themselves for what happened or taking unnecessary ownership for the events that transpired, and ultimately letting go of not being in control and accepting the event or events that occurred. Number 5, emotional freedom technique, EFT, operates on the assumption that we can feel better by removing or releasing unresolved emotional barriers while using our fingers to tap on particular body points of the body, referred to as energy pathways called meridians. While tapping on the meridian points, you simultaneously think about a past event, incident, or memory that evokes a negative emotion. Thinking about the event coupled with simultaneous meridian point tapping is believed to release or lessen the intensity of the negative emotion. Finally, number 6, eye movement desensitization and reprocessing, EMDR, which is designed to resolve unprocessed traumatic memories in the brain, in which the therapist uses a hand motion technique to guide the patient's eye movements from side to side. I strongly recommend you check out my interview with Michael Kurjan, LCSW. He is a certified EMDR therapist, and he discusses it at length. I will also be keeping my eye out on psychedelic therapeutic approaches in the near future, as more and more companies are coming out with clinical trials on the effectiveness of psychedelics on various mental health issues, including depression and trauma. My experiences as a therapist have shown me that yoga, art therapy, and dance are 3 very effective strategies when dealing with trauma of any kind. What's most important to me is making it crystal clear that regardless of what some book says about PTSD, trauma is the most personal experience one can go through. And if you believe you were impacted, affected, and wounded so greatly in whatever way, shape, or form, then you did experience trauma. Please share in the comments below what you found useful in this video, and I would love to hear about what mental health topics you would like me to discuss. I've gotten some great ideas from my subscribers, and I look forward to producing more content for you. If you liked this video or found it useful in any way, please share it to someone you believe it may help. Please like the video, subscribe, don't forget to put the notification bell on so you know exactly when my next video comes out. Thank you for watching, and as always, be where you are, be resilient.